Welcome to the Banish Cancer channel. I'm Sarah, and today we're talking about how PTSD can affect cancer recovery and what you can do to support healing. For many survivors, post-traumatic stress disorder becomes part of the recovery story. It isn't always visible, and it isn't a sign of weakness. PTSD can develop at any stage of cancer care, during diagnosis, throughout treatment, or even years after recovery. Studies show that between 4% and 55% of cancer patients experience PTSD symptoms, and about one-third of survivors continue to feel its effects years later. That's why it's so important to recognize the signs early and talk about them openly. Think about the moments that can trigger trauma. Hearing the words, "you have cancer," lying perfectly still inside a scanner, or feeling powerless during a procedure. Even the confined space of treatment rooms or the touch of medical staff can bring back distressing memories, especially for those with a history of trauma. Almost all women with breast cancer report at least one traumatic event related to their disease or treatment, and more than half describe intense fear or helplessness during those times. Symptoms can vary widely. Some people avoid reminders of cancer, skip appointments, or withdraw from loved ones. Others may struggle with nightmares, flashbacks, guilt, or constant anxiety. Physically, PTSD can cause fatigue, headaches, or even feelings of detachment from your own body. These challenges don't just affect mental health, they can interfere with treatment adherence and lower quality of life. In fact, research shows that patients with strong PTSD symptoms often find it harder to keep up with medical routines, even when they want to. But here's the hopeful part: PTSD can be managed. Therapies like cognitive behavioral therapy and EMDR have been shown to reduce cancer-related trauma. Acceptance and commitment therapy, expressive writing, and positive psychotherapy can also help patients regain hope and foster growth. Support groups provide emotional connection and practical advice, reminding survivors that they are not alone. And self-care practices, such as meditation, journaling, yoga, or music therapy, can bring calm and strength. For some, medication prescribed by doctors may ease symptoms when combined with therapy. Early intervention makes a big difference. Patients who seek help soon after diagnosis often feel more resilient and hopeful. If you notice symptoms lasting longer than a month, or if daily life feels overwhelming, reaching out to a mental health professional can change the trajectory of recovery. Remember, asking for help is not a sign of weakness. It's a step toward healing. Support is available through cancer care centers, therapists who specialize in trauma, and community or online support groups. Caregivers can also benefit from these resources since they often carry their own emotional burden. Healing is stronger when both patients and caregivers receive support. PTSD is a real part of the cancer journey, but it doesn't define you. With therapy, support, and self-care, recovery becomes more than survival. It becomes healing. If you or someone you love is struggling, know that you are not alone, and support can make a real difference. Thank you for watching the Banish Cancer channel. I'm Sarah, and I hope today's video helps you understand how PTSD can affect cancer recovery and how you can take steps to support healing. Stay strong, stay connected, and remember, healing is possible.